Here is a number that may truly surprise you. Right now, as you are watching this video, nearly 8 out of 10 adults over the age of 60 are living with some form of chronic back pain. That means most people in this age group wake up stiff. They struggle to bend down. They move carefully during the day. And they manage pain that never fully goes away. This is not rare. This is normal aging for many people. But here is the important part. Back pain after 60 is not something you have to accept as permanent. In fact, research has shown that the right kind of movement can reduce back pain far more effectively than rest or medication alone. A major long-term study followed more than 5,000 adults for almost 10 years. The researchers found something very important. People who performed specific, targeted exercises reduced their back pain by up to 70%. That is not a small change. That is a life-changing improvement. Even more surprising, they did not need complicated workouts. They did not need machines. They did not need hours of therapy. They used just 3 simple movements. Not gym routines. Not expensive equipment. Not painful exercises. Just 3 movements that work with the aging spine, not against it. Now you may be thinking, I have tried exercises before. Exercise made my pain worse. Nothing has helped me so far. That reaction is very common. The problem is not that exercise does not work. The problem is that most exercises are not designed for people over 60. Your spine is different now than it was 30 years ago. Your spinal discs hold less fluid. Your stabilizing muscles are weaker. Your nervous system processes pain differently. These changes require a different approach. The 3 exercises in this video are designed specifically for how the spine functions after age 60. And I want to be honest with you. The most powerful exercise on this list, the number 1 exercise, is probably not what you expect. When researchers studied over 1,200 older adults with chronic back pain, one simple activity worked better than stretching, strengthening, massage, and spinal manipulation. It became so effective that the researchers recommended it as a first-line treatment for back pain in older adults. But before we get there, let us start step by step. We will begin with exercise number 3, then move up to number 2, and finally reveal the most effective movement of all. Before we begin, tell us in the comments. How old are you and where are you watching from? We read and reply to every comment. Now let us begin. Number 3, the cat-cow movement. The third exercise on this list is called the cat-cow movement. At first glance, it may look too simple. Some people even dismiss it. But the science tells a different story. In one study, 240 adults with chronic lower back pain were followed for 16 weeks. Half of them performed the cat-cow movement daily. The other half changed nothing. The results were clear. The group doing cat-cow reported a 42% reduction in pain, a 38% improvement in daily activities. That came from one gentle movement. So what is happening inside your spine during this exercise? As you move slowly between rounding and arching your back, each vertebra moves slightly. This is called spinal articulation. After age 60, the discs between your vertebrae lose hydration. They become stiff and dry. Cat-cow works like a pump. It gently pushes fluid into the discs and keeps them healthier. Think of it like squeezing and releasing a sponge in water. That movement keeps the sponge soft and flexible. Cat-cow also relaxes the long muscles that run along your spine. These muscles often stay tight all day. When they stay tight, they compress the spine and reduce blood flow. That creates pain. Slow, controlled movement teaches these muscles to relax again. How to perform cat-cow safely. Start on your hands and knees on a comfortable surface. A mat, carpet, or folded blanket works well. Your hands should be under your shoulders. Your knees should be under your hips. Take a slow breath in. As you breathe out, gently round your back upward. Let your head relax downward. Hold for 2 to 3 seconds. Then breathe in. Slowly drop your belly toward the floor. Lift your chest slightly. Do not force the movement. Move slowly. Research shows that slow movement works better than fast movement. Aim for 5 seconds in each position. For most people over 60, start with 8 to 10 repetitions. Do it twice a day. Morning and evening work best. If getting on the floor is difficult, you can do this exercise sitting in a chair. The seated version provides about 75% of the benefit, which is still very helpful. If you have severe osteoporosis or spinal stenosis, talk to your doctor before starting. Number 2, the bird dog exercise. The second most important exercise for back pain after 60 is the bird dog. This exercise looks simple, but it works very deep muscles that most people never train. Researchers found that bird dog activates the small stabilizing muscles of the spine. These muscles connect one vertebra to the next. They keep your spine steady when you move. With age, these muscles often weaken faster than larger muscles. When stabilizers weaken, bigger muscles try to compensate. Tension increases. Pain develops. Bird dog directly fixes this problem. Why bird dog works so well? Bird dog strengthens the spine without compressing it. Unlike sit-ups or crunches, it does not squeeze the discs. It challenges your balance and control in a safe way. Studies show it reduces back pain recurrence by over 60% when done consistently. How to perform bird dog correctly. Start on your hands and knees. Before moving, gently tighten your stomach as if someone is about to poke you. Do not hold your breath. Slowly extend. Right arm forward. Left leg backward. Keep your back flat. Do not arch. Do not twist. Hold for 5 to 10 seconds while breathing normally. Return slowly. Switch sides. For best results, do 8 to 12 repetitions per side. Hold each one for 10 seconds. Perform once per day. If this feels too hard, start by lifting only the arm or only the leg. Progress slowly. Consistency matters more than intensity. Number 1, walking. Now we come to the most effective exercise for back pain after 60. It is not stretching. It is not strengthening. It is walking. This may sound too simple, but the research is overwhelming. Large studies comparing walking to other treatments found that walking works as well or better than most therapies. Why? Because walking does many things at once. Why walking helps the aging spine? Walking gently loads and unloads the spine with each step. This improves disc nutrition. It increases blood flow. It reduces inflammation. It also calms the nervous system. Chronic pain often comes from an overactive pain response, not damage. Walking helps turn down pain signals naturally. Studies also show walking reduces inflammation, improves mood, lowers anxiety and depression, improves sleep. All of these reduce pain. How to walk for back pain relief. The research shows best results when walking is done properly. Duration: at least 20 minutes per walk. Frequency: 5 to 7 days per week. Pace: moderate pace. You should be able to talk but not sing. Start slow. If you can only walk 10 minutes, that is fine. Increase time by about 10% each week. Choose softer surfaces when possible. Wear cushioned shoes. If possible, walk with a friend. People who walk socially stick with it longer. Putting it all together. These 3 exercises work best together. Cat-cow improves mobility. Bird dog improves stability. Walking restores function and reduces pain sensitivity. Do them consistently. Most people notice improvement within 6 to 8 weeks. Some sooner, some later. The key is patience. Your back did not become painful overnight. It will not heal overnight. But with steady effort, relief is possible. Thousands of people over 60 have already used this approach successfully. There is every reason to believe you can too. Now tell us in the comments. Do you live with back pain? Which exercise will you try first? Your experience may help someone else. Thanks for watching.